you. Hi, everybody. Welcome to this session number 2 for Kings and Tulare County. This is a project of CalAIM Links. We are providing technical assistance and resources for community supports providers. We are so excited to have you all with us today. I am going to get us started, and a few more folks may trickle in, but I'll do some kind of housekeeping at the top here to get us kicked off. So if you go to the next slide, Melissa. Just want to say that we are recording this session, and I think everyone would have clicked yes on that to get admitted to the room, but wanted y'all to know that. If you go to the next slide, just welcome everybody. My name is Sadhana Devaraja. I'm Managing Director at HealthBegins. I'm here with some of our colleagues at HealthBegins, as well as our partner organizations, and we'll give in a couple of slides, I'll get to those. But I wanted to first, if you go to the next slide, just let everybody know we do have a great website available for this project. For the content you'll see here, we do upload these after sessions. You'll be able to reach previous sessions through this link. So just want folks to know, for all CalAIM Links related content, you can go to this website, healthbegins.org/CalAIM, and we'll put that in the chat for you. So that you can easily access that. I know a question that comes up early and often is, are these slides going to be available, or is the recording available? And that's where you'll be able to see that available. I wanted to make sure that we are able to recognize our partners that are so crucial for this work. So this work is funded generously by the California Healthcare Foundation, and we work in partnership with Aurrera Health Group and Transform Health. And I know some of our partners are here on the call today and are certainly a part of, the content creation and all of the heavy kind of consideration that goes into developing these sessions and outreach for these sessions. If you go to the next slide, just on that California Healthcare Foundation point, I wanted to especially thank Carlina Hansen, who is our program officer. She's the senior program officer at CHCF, who is helping guide this work. So if we go to the next slide, just wanted to make sure we covered at the top the objectives. So to make sure you're in the right room, that you're getting what you signed up for, wanted to lay these out. So by the end of today, we're hoping that everyone here will be able to understand elements of HealthNet and Anthem's certification application, name some CalAIM related funding opportunities. We've heard from a number of CBOs across the state, just all these requirements require capacity building, and to do that work, you need to be funded for it. And so we want to spend a little bit of time to go through some of the opportunities that we're aware of. We're hoping by the end of the meeting, people can identify performance reporting requirements, billing and claiming requirements, data sharing requirements for becoming a community supports provider. Obviously, with an hour and a half, we're not doing deep dives into all of these pieces, but we do want to present them and have them for you to review afterwards, as well as ask any questions, raise up any pieces of those requirements that have been causing concern for you. And then really importantly, we're hoping we get to know each other better. So for the CBOs in the room to know each other better, for the health plans and the CBOs to get to know each other better, and to just be able to share, what we're learning and what we're experiencing through the CalAIM implementation related to community supports with each other in this space. So if we go to the next slide, on that point of getting to know each other, I would love it if you all could update your name on Zoom with your preferred pronouns and the name of your organization. That would just help us as we see your interaction on chat. There are points where I'm hoping we'll be able to call on folks in the room to ask for your experience with a certain part of the application, or certain point regarding requirements related to responding to poll questions. We are hoping for this to be a little interactive, so please let us know how you'd like to be addressed by updating that information. And as an icebreaker, so I know we have quite a few members, CBOs on this call. If you could, in the chat, just add in what you're looking forward to this fall is kind of something that we can get to know. Thank you, Leslie, for kicking this off. Cooler weather in the valley. I think that's shared by everyone here. And maybe as an aside, earlier today, I received notice from our energy company that there's going to be rolling blackouts, possibly during this session. So we have backups in place for facilitation, but just kind of an indication of cooler weather. Oh my gosh, even seeing sweaters makes me feel hot. Kathy, love that horror nights at Universal Studios. Brave. Seasonal drinks at Starbucks. You have a friend, Stephanie and Melissa, who also enjoy Starbucks. Apples, love these. So thank you. I think all of this is really helping me feel cooler to get to that point. And in testing this out, just really love, and please keep sharing, just because I'm going to move on a little bit. Still would love to hear from everybody here on what you're looking forward to this fall as we move ahead. And to continue using chat throughout this session. Watching football every weekend, good one. I love that. So as we mentioned at the top, this is the second session of a series. It's a series of 3. And today we're focusing on preparing to contract. And so I'm wondering if folks could give a thumbs up or raise your hand if you were a part of session 1, just so I have a sense of kind of your familiarity with this series. Or you can chat it in kind of however you want to give that feedback. Who's been a part of this room before? I think some of these names are actually familiar even to me. Kathy's been here before. Nice to see you again, Kathy. I know in some of our other session 2s and other counties, we've had 1 or 2 repeat participants as individuals, but organizationally, there may have been other representation on previous ones. But it's helpful to know, at least Kathy, you've been here before. And there will be a session 3 as well on best practices for becoming a community service provider to come in November. And I will say that, just because you weren't here previously doesn't mean that this content, you'll miss anything on this content. We've designed it so that it's still helpful if you're a first timer. And also you can go back to that website and find previous sessions and complimentary content as well to catch you up. So I am going to go to the next slide. So based on, those objectives that I shared earlier, this is how we're planning to get through the next hour and a half. So talking through kind of some background on becoming a provider, then doing some deeper dives on the applications. We know we have some of our health plan partners here who I'll introduce in a second, who will help support walking through those applications, talk through the funding opportunities, and then go into some of the more kind of detailed technical aspects of the monitoring report and then billing and claiming. If you go to the next slide, we kind of share this at the outset because we want to make sure that everyone in the room is on the same page in some ways, and those ways are by location. So CBOs that are in attendance here are located in Kings or Tulare or serving Kings or Tulare counties that you've been in. You're interested in pursuing a direct contract with Anthem or HealthNet for those 2 counties. You may be looking to subcontract through another intermediary. You might be looking for direct contracting, but that's essentially your goal, is to contract on community supports with those plans. That you have some baseline information on community supports, either through some of the trainings that we've offered statewide or in previous sessions. You kind of understand CalAIM on at least a name basis. And so a lot of that foundational work we're not doing here, right? We're not going to really explain what CalAIM is. We're not really going to explain much of what community supports are either. But we do have other content available on our site to get that level of inquiry. And that many of you have completed the CBO readiness assessment coming into this. And thank you, Melissa, for sharing that link in the chat. So if you haven't, you're able to complete it, in the days ahead. But that's really how we landed on the topics for today, in addition to working with our plan partners. And I'll share that in a little bit. But it's helpful in terms of understanding curriculum needs. So I know I did a lot of talking right at the top here, and I want to launch our first poll so we can hear from you all on where you are in the contracting process. So if we could launch this poll, and I may call on folks as we get these responses in, but just to better understand, to make sure we're speaking at the right level and period of engagement, to understand, are you just beginning to think about it? Are you, you've thought about it and you're getting materials together, started talking to the plans, you've submitted some pieces of information, maybe you submitted and now you're reviewing the contract, or you're already contracted. And I actually can't see how far we are in responses. And so I'll kind of let my team signal to me when do we have a good amount of responses in?
So far, we have 3 responses, Salman.
Okay, I'm wondering if a few more folks could fill in where they are in the contracting process. Are we seeing any more movement?
We got one more.
Okay, why don't we close it out, and I'll actually call on folks and we can chat about it. So of the folks that have responded, it sounds like most people are reviewing or already contracted with a managed care plan. Is there anyone here that is earlier stage in that? Earlier than reviewing a contract or already contracted? Maybe I'll ask Kathy first. You were so generous with raising your virtual thumb earlier, to see, kind of hear from you on where you are. Kathy, do you mind?
Hi, yes, I was trying to unmute. Oh, hey, and there's one of my peers is here, Angela Garcia. Right now we're in the contracting, we're in the process, reviewing the contract, getting it through our contracts unit or specialist. Also turning in the rosters and making sure that we have everybody on board for that, and doing the in-house credentialing, making sure all that process is done as well. So we're on the verge. We're on the verge, and we're really looking forward to it. We're excited about this.
That is great, Kathy. And are you on the verge with both plans or?
Yes.
Okay.
Yes.
That is great. Thank you for sharing. And which community supports are you delivering? Are you serving?
We're doing the I'd have to look at my paperwork. Don't ask me to go through my mountain of paperwork. I have other things to do.
Yeah, no problem.
You understand. I believe it's going to be the housing navigation.
Okay. Housing related ones. Yeah, that's great. Thank you, Kathy. And it sounds like you and Angela are peers. I'm wondering if I could go over to Anthony and just kind of check in. Anthony, I don't know if you're able to unmute. Tell us a little bit about who you are.
Sorry, am I the only Anthony I think you're referring to?
Anthony Martino.
Yeah, so yeah, I'm here with Champions, and I don't know how much help I can be on the contracting side because our director, Frank Ruiz, actually completed the contracting before I started. He did it through late 2021. So we were eligible to begin our CalAIM services January 1st. I was hired and I started ECM and housing navigation, housing tenancy, and deposits. So we were at the almost 9-month mark now. So we're doing really well. We're growing our caseloads, learning a lot. There's a lot of hurdles, but it's been a great experience. And I saw Crystal Harris is on the call. She's been a fantastic resource for me with HealthNet. So she's been there the whole time helping us develop a program and providing a lot of support.
Love that. Thank you so much, Anthony, and love that background, and the shout out to Crystal, who we agree is great. And appreciate that both you and Kathy and Angela sound like are in the housing navigation space. So that's really helpful. I'm going to call on one more person for this poll. So maybe Francine, I don't know if you're available, Francine Gibson, to just let us know a little bit about, what community supports you're interested in and where you are in the contracting process. give it a second to see if Francine, you're able to unmute or chat in. And if not, I'll come back to you. Okay, I think that's really helpful. Thank you, both Kathy and Anthony. And we can move to the second poll. Thank you. So this poll is, all of these should sound familiar to you because they were included in our objectives in terms of what we're hoping to cover today. And if you can fill this out, this will be really helpful for us as facilitators to figure out, are there parts of today's agenda that we should spend more time on versus others. And so if you could, click off where you're most interested in learning about today, that'll help us pace ourselves appropriately. So these are all topics that we're planning to cover today. And again, maybe Rishi, you can voice over when we have like a good number of responses.
Yep, 4 responses so far.
Okay. I'll give it just a couple more seconds here to see if we can get 1 or 2 more, just to make sure, what we're talking about is going to be of benefit to you all today. And I would say if like all of them feel unfamiliar, click on all of them, and that's perfectly okay too. Maybe we should close it.
Yep.
Okay. So it sounds like a lot of folks are interested in the reporting requirements, data sharing, and billing and claims. And this is really helpful because those were kind of later in our agenda. So we'll be able to, maybe as we get to the part about provider interest and certification applications, we can do another check-in to see like how far we need to go in terms of like workshopping those for this audience. See if anyone is unfamiliar here. So if we go to the next slide, just wanted to kind of take a second to talk about how we came to those topics. As I mentioned earlier, we had that CBO readiness assessment that we were relying on. So folks who had filled that out, thank you so much. It was really helpful in pulling up really what we saw in the survey right now as well, that these performance reporting requirements, data sharing, and billing and claims is really helpful. We also heard from our plans that the provider interest forms and certification applications seem to be places where we can lend support to CBOs. And so that's why they came into the agenda for today as well. So pulling together what we're hearing from both of you, this is how we landed on those 5 topics. And so just really thank you for your feedback because that's the only way that we can make this meaningful for all of us. If we go to the next slide, I wanted to just give a second for our plan partners to be able to introduce themselves. And so maybe, Brandy, if I can call on you first to introduce yourself to the group here.
Sure. Hi, my name is Brandy Jenkins. I'm your regional program manager for the Central Valley and the Rural North counties for HealthNet. Nice to meet you. Oh, excuse me, for Anthem. Sorry, for Anthem. Used to be HealthNet, but now Anthem. Sorry about that.
I'm going to take that as a nod to how closely you guys are working together and
Very closely.
inspiring confidence for all the CBOs here that you are so aligned.
We're like family, legit family. Yeah.
Love that. Love that, Brandy. Thank you so much. And then Leslie, I'll ask you to do the same.
Leslie Badeau, I'm the program manager for HealthNet. And yes, Brandy and I do work very closely together. We even live in the same city. So we have a lot of collaboration, and I do offer program management support services to Kern, Tulare, Stanislaus, and San Joaquin counties. So just a pleasure to collaborate with everyone on here. Thank you.
Thank you so much, Leslie. And I don't know if Crystal would also like to introduce yourself.
Sure, I can do mine. I'm Crystal Harris, manager of operations for anything and everything Medi-Cal. I specialize in the Central Valley, but I touch all counties and regions and you name it. And happy to be here.
Thank you so much, Crystal. And we're going to kind of have this refrain throughout. And for those of you who have gone through contracting already, you probably already know this, but we're so grateful to our managed care plan partners for being here in the room, because kind of the through line through all of this is that they are your best resources for technical assistance in getting contracted. And that's shown through their support of these sessions, as well as, what you'll see them present on today and through the future. Everything that I've heard from CBOs who have gone through this process in nearly every county that we're working in with HealthNet and with Anthem, especially, is just that rely on your managed care plan contacts to get you through these questions that you might have. You don't need to put through a perfect final product because they can help you answer those questions as you're kind of navigating the requirements. So just wanted to make that plug for our partners and contacts there and express gratitude. So if we go to the next slide, I'm really going to rush through this because I think a lot of this foundational piece about what our community supports are covered in other content areas that we have. So the next few slides are about community supports. And if we go to the next slide, you'll see, what our community supports, we know what they are here, right? They're offered in lieu of traditional Medi-Cal benefits. There's a list of 14 of them. Managed care plans are encouraged to contract with community-based organizations to provide these supports. And that's why we're all here today. If you would like a deeper dive on this, I, again, would direct us to the CalAIM website, including the one that's on healthbegins.org, to get some of this foundational background on the community supports. If you go to the next slide, some of the role of the providers at this point are to contract with plans to be able to provide these medically appropriate alternatives to state plan services, to deliver those medical and social services, some of which we heard today, thanks to Kathy and Anthony, in terms of housing navigation, recuperative care. There's that full list that's available on our websites. But really to also in delivering those services, which you have been doing likely for a long time, is to meet the contracting and reporting requirements related to those care models. And that's the piece that we're hoping to help shed light and some lubrication to make it a little bit easier to meld what you've been doing so well with some of the opportunity within CalAIM. And so if we go to the next slide, some of what you see here is on those requirements that are being asked of community supports providers. What you'll see on the left-hand side of this slide are some of the pieces that we've shared in session 1. And so for those of you that were part of session 1, you would have already had this covered. You can also access that session even if you weren't there in person. But today, we are looking at the kind of pieces on the right that we didn't get a chance to cover previously. And then I would say we had a few updates on reprocurement. And so maybe through thumbs up or hands, wanted to see if folks had any, had been hearing about reprocurement announcements that came out last week from DHCS. Coming into this meeting, we thought that since the announcement was fresh, folks might have some questions on it. There were some announcements made from DHCS last week on reprocurement of managed care plans through the state for all the counties in the state. And so we just wanted to spend a second here because some of the questions that we were hearing through ourselves as well as our team was on those decisions and kind of which plans would be working in which counties looking to the future. Just wanted to say that those decisions were not final. So our understanding is that a number of plans are still working with DHCS, appealing to DHCS to figure out which counties they'll be servicing. As far as everyone knows, we're still on track to provide community supports, all the plans that you know of here, as well as throughout the state are on track to provide community supports throughout 2023 of next year. So all the work that you're doing in terms of getting contracts set up is definitely still valid and helpful. Some of what we heard kind of modeled through Anthem and HealthNet here is this reciprocity of, how closely they're working together When we look at some of the application work, I know that both HealthNet and Anthem are working with each other. So if you're a CBO that's applying through one plan, they're working with each other in terms of sharing information if that's requested by you, so that CBOs are not kind of duplicating effort. And we anticipate that that level of reciprocity, would continue as final determinations are made on which plans will be serving which counties. And so all of the best advice that we have is that CBOs should continue on the contracting paths that you're on as final determinations are made from the state. And happy to field, questions on that as needed, but wanted to address that. So with that, I'll go to the next slide on certification applications. And so with this, I'm going to turn it over to my colleague Rishi Manchanda. And so Rishi, if you could take it from here to lead through this section.
Thanks, Alvina, and thanks everybody. Hi, I'm Rishi Manchanda. I'm CEO at HealthBegins. I'm a primary care and public health trained physician and have the privilege of working with my colleagues not only at HealthBegins, but with our partners on this project team at Transform Health and Aurrera Health. So it's really great to spend some time with all of you. As Alvina mentioned, we wanted to make some space for a brief discussion or a reminder for those of you who already are aware of this, of the certification application requirements from both HealthNet and Anthem. And to that end, I want to go to the next slide here and introduce Leslie from HealthNet to walk us at a high level through the certification process for HealthNet. Again, it sounds like based on the survey results that some of you already have gone through this process, but this hopefully is helpful for those who have not. Leslie?
Thank you, Rishi. Yes, I'll go through this quickly because overall from the survey results, it looks like everybody's kind of getting to the contracting phase. So basically the certification process does require that you obtain an NPI, and that's a pretty simple process to do. And the links will be, of course, provided in the slide deck. And then we have a provider interest form. So if anybody does need a copy of those, they're located right there also within the link. You're able to, there's direction on there where to submit those back. And then once we receive the letter of interest, basically what we look at the needs of every county. So each county is a little bit different. Each county has had a different needs assessment completed and they have different gaps. So we'll review the gaps in the county, we'll see where the needs are. And if the letter of interest meets those needs, then we'll go ahead and we'll start with the application process. The application process, the one thing that we have collaborated with Anthem on is if you complete their application, you can submit that to us, or you can ask us to reach out to them to get a copy and vice versa. So we've tried to collaborate where it makes that part easy, where we share some of the same applications that just kind of help the process move along a little faster. And then of course, once that piece is reviewed, it takes usually a week to get that reviewed. We do start the contracting phase, which, requires just the basic standards of contracting with any health plan. So that is it on the certification process for HealthNet.
Okay. Information, Leslie, for the provider interest form, if you want to speak to that.
Yeah, sure. The provider interest form is really, it's just the information on your practice, what type of business you are, what your business address is, and then of course the capacity. So depending on what services you offer, whether it's short-term post-hospitalization, then we're looking at how many beds you have. And if it's day habilitation, it's how many patients can you serve. So just capturing the capacity so we make sure that as we continue to grow and add new community-based organizations to our network, that we're able to serve all of the members in the area. And then yes, the certification application piece, again, it takes a week to review. It's really just making sure that the DHCS requirements that are in place for community-based organizations are within your policies and procedures. So everybody can, the application is long. And if you haven't seen it, it is very long, but all organizations only have to complete the first two sections. It's your provider information, your general section. And then there's 2 pages typically for each community support service. So if you were going to do housing navigation only, you would complete the 2 pages for housing navigation. Whereas if you were going to do 3, you would complete the 2 pages for each of those. Again, it's just really to show that you have policies or procedures and job descriptions in place that really meet the requirements of the CalAIM program. And then this is just, you know, basic information on there. I think you can go to the next slide, Rishi. And then, yeah, that's it for me. I'll pass it back to you, Rishi.
Thanks, Leslie. Yeah, and I'll just turn it. Thank you so much for that. And Brandy, if you're available, maybe this is just a high-level overview. There's a couple slides here about the letter of interest as well as the certification application.
Sure. Okay, so our letter of interest is a little bit different from HealthNet. We have our ECM and CS provider interest form. It's all on one. So what it is pretty much, does the next slide show ours? Yes. Okay, perfect. So there's just a quick snapshot of it, and we can, they can provide it if you guys need it afterwards, but it sounds like most people are contracted. However, what our process is, so we starting at the top, it just gives your organization information and then your point of contact information as well. And then it asks if you are a remaining or becoming an ECM or CS provider. And then it goes down to the organizational services. So what county you're going to be providing your services in. And then it goes down to ECM first. So first you would fill out what ECM services you provide if you are an ECM provider. If not, you would go ahead and skip that section. And then with the rest of that, then it goes to the members that are actually you're serving currently. And they're all just little check boxes. So you would just check those off. And then it goes down to the targeted population that you are wanting to serve. And again, those are more check boxes. And then we get into the CS services. So it's the same type of thing. You provide the services, you'll check off the boxes of the services that you do provide. And then next you'll fill out or check off the boxes for your organization's service delivery. So that could be primary care, specialty care, mental health, so on and so forth. And then lastly, you're going to provide your organization's patient population. So kids, adults, SMI, SUD, whatever you're applying for. Next. And then here is our, this is our community supports certification, which like Leslie said, you can use either ours or theirs. Ours is a little different. I think our first two requirements are kind of split up, so it kind of can be looks a little different. So we have one section required at the top, and then at the end, we also have another required section. But for the rest of it, everything else is pretty much the same, and you can use either or because we do share. We do spend a lot of time talking and going over gap analysis together. So we do work very closely. But as far as our process goes, first, we like to have our letter of interest back, and then we provide the application, either ECM or CS. And then that usually takes about a month or so going back or forth. Yeah, thank you. And then from there, we will review the application and then go over the gap analysis. So we usually, if we do it with HealthNet, we'll review together, or if you're just doing it with us, then we will review that with you separately, and then we'll give that back, letting you know whatever gaps need to be filled. And then from there on, we go back and forth, either email or phone, collecting all the documentation. And once all that documentation is collected, then we do a warm introduction off to our contracting team, and then they will reach back out and let you know exactly what else, the packet they have for you, the W-9, what are the documents they need on their side. And then from there, they finish the process. So total for us at Anthem, it can take anywhere from probably about start to finish 3 to, let's say 6 to 9 months, depending on how quickly the application is provided back to us and depending on how many gaps there are that need to be filled. Thank you.
Thank you, Brandy, and Leslie as well. I think we're going to pause for a second. I've been getting a couple of messages in directly just indicating that there may be some important questions that people just want to pause and clarify here, especially among CBOs around what's been covered so far. So let's pause here, and maybe I'll ask Melissa to stop sharing screen for a second before we proceed to funding opportunities, and see if anybody has any specific questions for Leslie or for Brandy, or about anything that's been discussed so far. There were certain questions that were coming up, and I know, Alexis, you had heard of some feedback that was coming through about elements that may still be confusing about the certification process, perhaps. So feel free to text that, and if there are certain kind of feedback you've been hearing in the chat as well that perhaps we can address. But anybody have any questions about the certification process, or clarifying any confusing parts of what's been discussed? Brandy, so Alexis, thanks. There's a question that came in from somebody that Alexis is conveying here. Can Brandy discuss the gaps they experience? So maybe that's a question, Brandy's for you, and we can turn the same question back to Leslie as well in that order. And that's based on the, I don't know if you're able to speak to the quality of the applications, or the kind of gaps in the applications that you're receiving, both the interest form and the applications. Are you, based on what you're seeing and what you received to date, are there certain common pitfalls or gaps in the applications that you think are, that you're seeing and that people should be aware about?
I think the main gaps we see on our side is just not getting enough detailed information. So we ask a lot for policies and procedures or workflows. Sometimes we're not getting, if we're asking for like a program overview or an organization overview, they're not gearing it towards the services that they're wanting to provide, if that makes sense. So we like to provide the ECM and CS policy guides, the DHCS policy guide, so that way they can use that as an outline when they're answering the questions, if that makes sense.
Yeah, that's really helpful. And before turning to Leslie, it sounds like that's a really helpful resource to perhaps bring up here and so we can, before the session's out, try to find those links and put them in the chat. The specific guidance, Brandy, that you're mentioning, that you advise CBOs to review from DHCS to be able to help complete the interest form and the certification application, right?
Yes.
So, yeah, that'd be great if we can find those and put them in the chat here. Thank you so much for that. And Leslie, similarly, any gaps or errors that you see in the applications that HealthNet receives?
I think just the same along the lines with what Brandy said. I will say, when I go back, because we get our documents back from like our delegation oversight committee, and then I'll take the gap closure document and I will review it with our providers, and then we kind of determine where we can help. And more times than not, I do see a gap in the culturally and linguistical training piece. And it's really just outlining how you train your staff in that piece, and also that's specific to your county. So that's just one area that I seem to always have a gap on for our providers. So of course, if you have any questions there, you're welcome to reach out to us, and we can provide you some resources as well.
Really helpful, Leslie. Thank you. Yeah, and thanks to Alexis as well as to Brandy for putting those links in the chat. It looks like the specific policy guide, the ECM policy guide, Brandy, is what you're referencing there from May. That's great. And I imagine that policy guide is still helpful for those applying for community supports as well.
Yes, and I'm looking for that one right now.
Thank you. Awesome. Well, great. Assuming that there's nobody who wants to kind of unmute and ask any other questions, why don't I'll turn it back over to you, Sadhna, so we can continue going through the rest of the session.
Yeah, thank you, Rishi, and thank you, Leslie and Brandy. And I think that I might have like a tie-in question to the funding opportunities section for Leslie and Brandy, which is, these funding opportunities that we're about to go through can help support capacity building for CBOs. And I'm wondering, for those sections of the application where, they have to indicate what capacity they currently have, how do they reconcile that with the capacity they're hoping to have based on funding that they'll be pursuing? Is that in conversation with you, or is there a way to indicate that?
Well, overall, we definitely want to know what the capacity is when you're first starting. And we, of course, always anticipate that everybody's going to ramp up. As the program rolls out, you may start with a small staff, and then you just continue to expand and expand as you are able to get more and more referrals from people. That is also something that you can definitely bring up when you're looking to IPP funding streams or PATH funding streams, is maybe you need coverage for the first 6 months of those services just so that you can ramp up. Those are definitely things that you can apply for through PATH funding. And you can also apply for through IPP funding. I will say that every county is different when it comes to IPP funding. We have different, again, needs assessments in each county, and there's certain measures we're trying to hit. So when we look to fund different areas of opportunity with our IPP funding, we are definitely looking at how are we going to close the gaps within this county with the dollars that were allocated to the county. Whereas PATH funding, it's not always just looking to close those gaps in the county. It's a direct connection with DHCS, just looking to expand those services statewide.
Thank you, Leslie. That's really helpful. And I'm about to go into like a little bit of an overview of IPP and PATH funding, and welcome both Brandy and Leslie's, insights to how that's playing out for Kings and Tulare, or anything else that we might miss here. But thank you for that answer. So if we go to the next slide, we're going to talk a little bit here about IPP, and maybe I'll ask folks, has anyone here applied for this funding or is interested in applying for this funding? While I, kind of continue speaking, just feel free to either enter in chat or thumbs up at a reaction if IPP is something that you're looking into for funding for your CBO, or that your CBO is looking into. So it looks like Kathy is, that's great. So here the IPP funds go to the managed care plans to support implementation of ECM and community supports. And as Leslie just mentioned, it's really to address the needs that the plans are seeing and to fill in those gaps that you're identifying. And so this is allocated by the county and the plan as kind of the route of transmission for the funding. If you go to the next slide, we'll continue talking about IPP a little bit. And so, this is really seen as a critical component of CalAIM to be able to really help promote plans and provider participation and to help with capacity building for community supports. And so the funding here has been allocated through June of 2024. And it's really to, build this sustainable capacity, to bridge current silos, to drive investment in system infrastructure, to promote health equity, and to really incentivize plans to take up community supports. And so, we're laying this out here to make sure that, CBOs are seeing that this funding is helpful for plans to be able to distribute, and that it should be distributed to CBOs that are able to, help contribute to these kind of intentions of the funding itself. If you look at the next slide, these are the priority areas for IPP in year one. And so it's kind of a little bit of what I just mentioned in terms of, that delivery system infrastructure for folks. So that could look like data exchange infrastructure, like HIT infrastructure. It's ECM provider capacity building, community supports provider capacity building, and quality. So baseline data collection and kind of building up that infrastructure for CBOs as well. So as you're thinking about what your organization needs to build up infrastructure, IPP might be an appropriate way for you to fund that work and to be in conversation with your managed care plan about that to see what might be appropriate. If you look at the next slide, thank you, HealthNet. The first payment application has closed, and it may be potentially first quarter of 2023 roundabouts, where another funding window will be opening. And so HealthNet will let folks here and their stakeholders know about when that funding opportunity reopens for them. And if you go to the next slide, the payment window for Anthem has closed. And they're still focusing on community supports, physical infrastructure, build out opportunities. And again, another possibility of new funding opening in 2023. I do want to pause here before going to path and cited funds, see if there's anything that either Leslie or Brandy want to add in terms of the IPP funding, the funding windows, or what gaps you're looking at more closely.
For IPP funding, just the one thing to say is it's really pay for performance. So the health plans have to show performance for the measures, and the measures are different from year to year. So again, when we're determining which applications we fund, it's based off of where we need to grow to close those gaps, or to meet those metrics so that we can continue to draw down funds for the county.
Thanks, Leslie. And Brandy, I don't know if I saw you nodding along to what.
Oh, I was just agreeing with Leslie.
Okay, is there anything else you wanted to add to that? You were like, she got it.
No,
Great.
she got it.
Thank you. So if we go to the next slide on cited funding, so this is what will go directly to applicants from the state. And this is where CBOs are listed as one of the eligible applicants, in addition to counties, cities, public hospitals, Medi-Cal, tribal, and designees of Indian health programs. We do recognize that CBOs are kind of smaller than some of these other entities that are eligible applicants, and really hope able to help support that application, understanding that there is a little bit of uneven playing field in terms of capacity to even fill out these applications, right? But there are encouraging coordination among the stakeholders in the county to help, I think, bring that weight together in filling these applications out and being able to disperse those funds. The funding window here is through 2025, so a little bit longer. If you go to the next slide, you'll see some of the funding categories. And I'll leave this up for a second so folks can read through it. And I didn't ask this question at the outset. Are there folks here that are looking to apply for cited funding or have already started applying for cited funding? Maybe not as much on cited, but there is this, they're looking to provide upfront funding to support capacity and infrastructure to deliver these support services on evaluation and monitoring, purchasing or developing any information exchanges or infrastructure, increasing workforce. So these are a lot of developing a plan to conduct outreach to populations who have been traditionally under-resourced. So these are a lot of the capacity pieces that we heard from CBOs along the way that, it would be great to do this work if we had the funding to be able to, set up this infrastructure. And this is the opportunity to draw down funds from the state to be able to do that. If you go to the next slide, the first application window is open through the end of September. And it will occur at a minimum semi-annually from this year through 2025. And you'll be permitted to apply during multiple application windows. And really importantly, I think, is that, they are offering retroactive funding back to the beginning of this year. So, we heard early on the call that Anthony, your organization, has already, been contracted and started on January 1st. But there is eligibility to retroactively fund some of that work during this first application window. So I'll pause here for questions. Before we, so, I mean, I'll kind of wait for a second here. I know we have a bit of a quiet crowd, but also as we go to this next section on monitoring report, I recognize there are, just a few CBOs on here. And so wondering if, kind of this didactic style is matching for Anthony, Kathy, and Estefania. And so if we go to the next slide on the monitoring report, I'm wondering if I can call on maybe Anthony first to see if you have like any specific questions on the monitoring report, kind of your interest on it. So as we go through it, we'll be able to hit on what's important to you. And I'm going to ask Kathy and Estefania the same question. So Anthony, would you be able to unmute and let us know if you have kind of like burning questions on the implementation monitoring report requirements? If it's like just generally understanding what they are.
I'm sorry, I missed that first part of the question. I had
No,
somebody in my office.
Oh,
I heard the second part.
no, just wondering if, we have, it looks like 3 CBOs on here. So I think we can like really tailor this piece of the content as we go forward. The pieces that we have left for our presentation here are on quarterly implementation monitoring report and on billing and claiming. And so just wondering, if there are pieces of the report that you've already seen that you have questions about, or about billing and claiming that you have specific questions about. And I'll ask Kathy and Estefania the same question, just so as we go through this, we can kind of dive in on specific questions that you might have already, understanding that you're already contracted, for example. So maybe you've already provided these reports.
Sure. So Estefania Garcia, I think she's, unless there's another one within the Valley, she's here with Champions too.
Okay.
But she can ask her own questions because she's part of our fiscal department. So I did have thousands of questions when it came to the claims process. And I think just through trial and error, maybe being one of the initial CalAIM providers in January and working through that with Crystal Harris. So in all, I presented to both managed care plans about a month and a half, 2 months ago. And I talked about claims probably being the most difficult aspect because I've never worked with managed care plans, but they provide a lot of support, a lot of presentations and documents, slides, phone numbers and contacts. And so I utilized everything. So I think with the claims, it was a trial and error, a lot of support with the errors, of course. And then when it comes to the monitoring report, we completed our first audit last week. So the audit was pretty self-explanatory. It wasn't too overwhelming. So we just had to put together our action plan and send that back. But I think what I mentioned as far as what I was interested in was expectations and goals. Like what does the managed care plans expect out of a successful CalAIM program, for navigation or tenancy or even ECM. So I don't know if that really falls under the monitoring report, but I think it'd be really awesome to hear what do they expect when it comes to like outcomes. And so that way it gives the CalAIM CBOs the opportunity to have the answer at the end and say, how can we build our program to get to the point of expectation? And so that's what I was looking for.
I love that. Thank you so much for sharing that, as well as you included some of your best practices through this process so far, and leaning on support and feedback, and that trial and error is okay, is also a super useful nugget. So thank you for that, in addition to that question on what is the kind of goal and expectations from the managed care plans. And I'm going to ask that question of the plans in a second, but I do want to see if we can get some of the other feedback from the group in a similar fashion. Thank you so much, Anthony.
Sure, thank you.
And so maybe I'll go to Estefania, and I'm sorry I butchered your name a few times here.
Oh, no, you're fine. So yes, I work with Anthony Moreno. So I am part of the fiscal department. So my concerns are more my questions and things like that. I'm here to support him. So as far as the billing and claims go, I'm more here to learn what the process is. So if he does need help, I'm there to be able to be his backup. I'm not fully in the program. I'm just more behind the scenes. So I'm just here kind of to learn what the process is, specifics and things like that.
Love that. Thank you so much. And Kathy, maybe I'll call on you next, since you're almost at contracting, almost at the finishing line here.
Hi, yes, thank you. We're almost there. We still have some things to work out and get hold of in our brains. And that's one thing that we have learned. We're traditionally been doing it the old way, the other way. And wrapping your head around this transformation of Medi-Cal, becoming managed care, has been kind of a hard nut to crack, but we're getting there. And we have a great team that has a lot of great minds that are meeting together. I also want to give a shout out to all of you, because you have helped. No one turns down a phone call. No one does not answer an email or ask a question or not answer a question, because you've been so helpful, the support. So I really appreciate that. I mean, Hato Ribeiro has been, from Anthem, has been great. He has really been helpful in walking us through what we need to do, what's expected. We haven't got as far as the audit part, and it's just getting past the old way of doing stuff, because our organization has always contracted with areas, with counties, to provide services. And we do really great behavioral services. We do housing navigation. We do all that already, but this is going to enhance the services. It's going to reach more people who are really in vital need of it. And I'm just, I think that organizations don't need to be scared of this. Just jump in with both feet. Someone's going to help you move along the way. Someone's going to assist you. If there's an error, they'll help you fix it. And we're cutting our teeth on this, so it's an exciting prospect. And I know I didn't really answer the question about the claims and the processing and how difficult it is. We're not there yet, but I'm sure I'll be back and I'll be telling you, oh my gosh. But I'm excited about this. It's a new way of doing business, and we're ready. We're getting ready.
I love that. Thank you, Kathy. And you have a question from Alexis here. Thanks for lifting up this question, Alexis, on, in terms of even like getting to this point where you're almost at the finish line. It sounds like you had many touch points with the planned staff, and love the shout outs to folks on that. What were those questions about? What were those kind of challenges that you were facing even in this part of like the pre-contract?
Some of the challenges is what exactly trying to get the structure, the staffing structure, because we've done it for so long a certain way, getting the clinical managers on board, finding out who's going to do what, who's going to be referring out to what service, that kind of stuff. And it's just a great way of opening up your minds. Hey, we haven't done this before. So you kind of have to be innovative within your own staff. And when people start talking, they're like, hey, I've always wanted to do this. I'm like, perfect. That's it. We've always wanted to do this. We've always wanted to do that. Now we're going to have the capability of doing so. So like I said, we're still very, very in the beginning stages, and polishing up our roster with all the forms that go with it. And that's another process, by the way. We never had to do this before. But when we were contracting with the counties, they did all the credentialing for us. Now we're doing it. So I don't know if anybody's had that experience, but it is a heck of a ride if you've never done it before. But man, I tell you, I've learned quite a bit.
I love that. Thank you, Kathy, and totally appreciate all of those challenges.
I'm just being honest. Just being honest. Don't be afraid. Everybody, just do it. Just go for it.
Love that. Love that attitude, and appreciate the staffing and workflow challenges that you kind of outlined as well. And I see Anthony's extending an offer here. Anthony, feel free to come off mute and speak with Kathy directly.
Yeah, Kathy, I was just thinking, I know how hard it is to start the program and especially go through the claims process. And what I try to do is provide support wherever I can, especially if it's local within Kings. That's even better. That's amazing, helping out a local CBO to even help, further support our population here. I have a meeting with HSA early September to work with supportive services over there and help them with their claims process. So just extending the same offer to you if you would like to meet with me and my team, and we can talk about the claims process, what we learned, and best practices and things like that. Just let me know if you want to meet.
I would love to, Anthony. I'm gonna put my email in the chat just in
Okay.
case anybody wants it. Invite me to places I'll go. And here you go.
Okay, I'll send an email.
I appreciate that.
Love
Thank
that.
you.
Thank you too.
Mhm.
Thank you both so much for that generosity and sharing your experiences, as well as, sharing your expertise now, right? Having gone through this, both of you, and just love seeing that happen here. Really a lot of gratitude to both of you. I am going to maybe move a little bit through the monitoring report. I don't want to lose that question that Anthony had asked of the plans in terms of expectations and goal setting. So I'll just kind of do this like basic review of the monitoring report and then pause at the end there to talk about, of these reporting requirements that are being asked really of DHCS, and then now that the plans are asking of CBOs, of these requirements, really what are these goals and expectations that the plans have for these different community supports. So one of the oversight reports that community support providers are required to submit are these monitoring report requirements. They're quarterly reporting requirements here. And so DHCS will work with and monitor the plan's implementation and compliance with requirements that are part of DHCS's statewide population health management strategy. And the kind of areas that they're monitoring are membership, service provision, grievances and appeals, provider capacity, and quality. I believe these are all available online. I don't have the link. I think someone on our team has the link and can share those with folks. And there is this recognition of administrative burden that's attendant with any type of reporting requirements, right? And so to relieve that burden as much as possible, DHCS has indicated that they want, existing data collection processes to be leveraged as much as possible to get the required data elements. And so if you go to the next slide, you'll see the timeline for these quarterly requirements. And so if a reporting period is for each quarter of the year, the report date tends to flow 2 months after the end of that to allow entities to be able to collect and be able to report during those 2 months after the reporting period. And it is anticipated that this is going to be happening for at least the next 3 years. And so you'll see that this timeline flows through August of 2024. If you go to the next slide, you'll see, some of these categories on membership and service provision, and that is mostly coming through encounter data that are on HCPS codes. There's a reporting category on provider capacity, and this is where plans will submit provider files, and additional information and guidance is, I think, forthcoming. And then on grievances and appeals, and they're kind of, it sounds like DHCS is looking through, or is revising the managed care program data file to allow for reporting of specific grievances and appeals data. But I do want to pause here to now revisit, this is what is required by DHCS on monitoring report categories. But to get back to Anthony's questions about, what are expectations and goals, which can be part of this, but could also be broader than this as well. And so wondering if I could ask Leslie and Brandy that question on your expectations and goals for community supports.
I've never actually been asked that question. So I guess it would just be to just serve our members as good as possible. You know, if you guys have questions, if you have concerns, please come to us as soon as possible. We're here to help you. I guess, yeah, just that's a great question. And I guess just whatever you think would be the best mode of way to, you know, to serve the whole person, to serve our whole members as a whole, and to get them the best care. That's what we're here for. I mean, this is a new stand-up, you know, program for everybody. So we're all learning together. So yeah, that's what I have. Leslie, what do you think?
Yeah, and I think it's just leveraging all of the tools that we're putting out there for you guys and making sure that those policies and procedures that you guys submitted to us and said, this is what we're going to do for the patients are what's happening within the plan, just because we do report that back to DHCS. But also leveraging that Find Help, the Find Help application for Tulare County. I'm not quite sure if it's rolled out in Kings County yet. And I think Crystal had to hop off. But that also is going to let us know that, great, thank you, Anthony. Yeah, so that's going to let us know when there's already referrals out for those members, and seeing provides a closed loop referral piece. So just leveraging the tools that we're giving you as new trainings come out, please take some time to access those on-demand trainings at your convenience, and then just making sure that you're following the policies that you guys put in place, just so if any audits do arise, that everything does align and we can check all of the boxes. And we're here to support you guys to hopefully continue to grow all of the organizations, because the whole purpose of CalAIM is to really connect all of the providers within a county, within a region, within an area, and also make sure those services are sustainable long-term to improve the livelihood of our patients. So I just, you know, kind of think following along with that.
Thank you both for those responses. And Anthony, I entered in the chat. I love when, you know, it's the first instance of a question being posed, because then it allows all of us to like reflect on that over the days ahead and think about what that question means to us, and appreciate Brandy and Leslie taking a first stab at that. And it also indicates to me that there's some ability to create those shared expectations and goals, and to be in conversation about that broader vision for your community, about what does, you know, a successful implementation of community supports related to housing and navigation, even narrowly, if that's, you know, where the conversation is at first. What does that mean for this community, and what does it look like? And I love that you're inciting that question, Anthony, in concert with the plans. So I really appreciate that. As we go to the next section, I think I'm going to turn it over to Rishi here for this kind of final chunk of content.
Thanks, Aldana. Yeah, and I think in the spirit of what this really good kind of dialogue that's starting out right now, especially in the chat as well, and what was just discussed, especially like how, you know, Anthony and Kathy, you were kind of collaborating and talking about ways to share and swap notes and its experience, and the last points about the quarterly implementation monitoring. I wanted to just tee up this segment because I know there's some questions and perhaps some collaborative opportunities here as well around billing and claiming. We're turning claims into a verb here. Go to the next slide, please. I think what many of you now appreciate, especially as you're based on the stages that you're at, is that there are expectations, especially for community support providers, to submit claims using national standards to the greatest extent possible. And there's also recognition that from DHCS's perspective that some providers, especially for community supports, may not be able to submit claims using those standards, and so they may instead submit invoices with minimum necessary data elements defined by DHCS. As you go to the next slide, you'll see some of those data elements, and again, this is probably something that you've all started to come across or review very closely because of the fact that you're now in contracting or close to, you now have a contract or are close to contracting. So you see some of the data elements here on the left for billing provider information, member information, residential address, primary payer, payer name, etc. And on the next slide, you'll see some additional required data elements as well regarding the procedure codes, including using the HCPCS codes modifiers, service start date and end dates, place of service, member diagnosis codes, or service unit costs, and service charge amounts. We anticipate there's probably some questions about this, especially based on what you guys have talked about before. So I think this is the last slide in this segment here, just to kind of tee up these elements. Oh, one more slide, sorry. And so here's some additional data elements on invoice and control number, authorization numbers, the last two being optional, at least in general, so we can get some clarity from Brandy and Leslie on this front. One of the things that DHCS has made clear is that plans must allow ECM and community support providers to submit invoices through an Excel-based workbook or a web-based form or portal using a provided template. There's a variety of transmission methods as well. And I believe that maybe it's Anthem and perhaps HealthNet too, but I know for Anthem, is it called Availity? Is that the portal?
Yes.
Right.
For our
Availity.
contracted providers, yes.
Yep. And so the information, the minimum data elements, I imagine will need to be submitted through Availity for the contracted providers, including community support providers, correct? For
Yes.
Anthem at least. And Leslie, what's the setup for you guys at HealthNet for submitting minimum data elements, especially if they
We have, so we do have the file formats that are available. They're out there on the provider site that the link is shared in here, and it does, and there's also an on-demand training for it as well. But essentially you can submit it in PDF, you can submit it in Excel, and then that walks you through the methods of which you can submit it to. There's several different methods in which you can submit it. We do have to make sure everything's secure, since there is some PHI with stored within it. But all of that is based out there in our link.
Wonderful. Great. We'll bring that link up again. And then there's also quite a bit, as you can see on the slides as well, at the bottom, there's additional data guidance from DHCS as well that may be helpful. But I think let's go ahead and pause here and actually see, because I anticipate that there's some questions that CBOs have, or there's some challenges that you've already come across on the CBO side. Or Anthem, at the Anthem and HealthNet side, if you're seeing from the plan's perspective some challenges that CBOs are having as well, please surface those. So let's pause for questions or sharing of kind of challenges and solutions. Maybe I'll go first to Kathy. Do you have any questions about billing and claims at this point, or is it?
That would be more of our billing and claims people and our IT people. They would know this, and they're going to find this interesting because I'm going to be sending these policies, the policy guides.
Great.
And we'll probably have a little meeting about this too.
Okay. Good.
Thanks.
I'll also say I think that the earlier offer, Anthony, that you made in the chat to Kathy about having a sit down to discuss claims best practices is also relevant in this regard, and obviously very welcome, I'm sure. So Anthony, anything else you wanted to add there, or Stefania? Or any questions about billing and claims based on your experience so far?
No, I'm okay, Rishi, at this time. Thank you.
Yeah, thanks. Great. And then from Brandy, from your perspective, or Leslie, based on common practices you're seeing or common challenges that are surfing from the contractor providers, especially if it's possible to talk about challenges you're seeing from community support providers, any common challenges that you think our friends on the line today on the CBO side should be aware of?
I think from my perspective, we recognize that typically the CBOs have not worked with managed care plans. That's traditionally, I should say. There are some, but usually you guys are working through grants, through counties. And so we definitely recognize that submitting invoices and or claims is very new for you. So just please never hesitate to reach out to us. We're here to support you. One area that I did find, and it was for a multi-county provider, and we actually ran across the issue yesterday. He was looking up some patients to see if they were in our system, and he could not find any of his patients. So for us, since he was multi-county, he was not in our HealthNet portal. He was on our California Health and Wellness portal. So there are some little caveats there that you might not find a patient. And if you are a multi-county provider and one county offers HealthNet and the other offers California Health and Wellness, unfortunately, we do have two different portals for that. And in those instances, the patient would not be found in the HealthNet portal or vice versa. So that's really the only issue we have run across. And then just getting that regular cadence with submitting their Excel-based invoices.
Really helpful. Thank you for that. And Brandy, similarly, feel free to add on to that if that's a similar challenge. I also wonder if there are particular, is there guidance or a link for those providers who want to know, how to log into Availity or create their Availity kind of login and portal information, or if there's any other challenges you're seeing from your perspective.
I don't work too much with the billing and claims. We actually have a team that does that. But as far as for our contracted providers, we do offer a weekly, maybe even twice a week, Ability Care Central office hours for our contracted providers, where they talk about claims issues and Ability Care Central, stuff like that. So if anyone is interested, I can get that link and share it with HealthBegins folks, and they can send that out for our contracted providers. But as far as like any issues and stuff, I'm not too well versed on that.
No worries. No, thank you. That'd be great. Yeah, just to be able to point people towards where they can receive more support if they have questions on the Anthem side in terms of billing and claims. Thank you for that. Well, I know we're at 3:20 here. Covered a lot of kind of ground. Saladin, I'll turn it back to you.
Thank you so much, Rishi. And so if we go to, we can do this poll quickly. I know we've got a small crowd here, so we can just kind of launch it to see if, which of these takeaways was helpful to you. And again, this is really so that it can help inform some of our other county sessions to hear which of these pieces were helpful today. If you could just take a second to mark one or two of these, or however many. And I think we can probably close it out now. I don't have, okay, great. It sounds like all of them were great. So thank you for that feedback, as well as the feedback from Kathy in the chat. Really appreciate everything that you all have voiced over, that you've put in the chat, and have indulged us with these polls. So really appreciate your participation today. If we go to the next slide, if there are any questions, please feel free to ask them in the chat now or unmute. I think we've kind of addressed some of these and kind of gave space earlier on as well. But I'll just give a moment here if there is something burning for anyone here. And thank you, Melissa, for raising up our post-event survey for folks here to take if you have a moment, especially because I think we will be able to close out here in just a couple of minutes. You'll have a few minutes to be able to take that survey if you're inclined. If you go to the next slide, I believe this is the survey that was put in. And if you go to the next slide, just another reminder that the presentation resources are available at healthbegins.org/CalAIM. You can access this presentation. You can share it with your colleagues that may not have been able to attend. You can get many of the links that were shared today, as well as others, including upcoming events through that site. If you go to the next slide. Want to make sure we thank all of the folks who put in hard work to getting this session and these sessions together, not least of all our partners at Anthem and HealthNet. Thank you so much, Brandy and Leslie, and share our thanks to Crystal. So glad that you all and your colleagues got shout outs from a number of folks here for all the work that you've been doing, obviously outside of these sessions, just in the community and working with folks who are courageous to jump right in and know that you're there to help guide them through some of those through some of those learning needs. So really appreciative to both of you for being here today, and also, kind of always for the community. Next slide. Special thanks to the CalAIM Links project team at HealthBegins, led by Alexis Taylor. So thank you so much, Alexis, for all of your leadership, and Melissa for your leadership as well, especially, leading up to this session, and Shiva, all of your support, and of course, Rishi as well. So really appreciative of our team here at HealthBegins and bringing this content, as well as our friends, if you go to the next slide, at Transform Health. So thank you all, Gretchen and Carrie, as well as Lisa, for all of your contributions in getting this content together, and Beth at Mount Auburn Associates for providing evaluation support to ensure success of the work that we're doing here together. So if we go to the next slide, finally, just thank you all for your participation today, for joining, for sharing this, and for really being in community with each other as we move forward. We hope to see you and your colleagues in session 3 to come in November, and hope to be in touch in the meantime as well. Thank you all for joining us today.
Thank you.